Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, October 17th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, for the third week running, our focus once again is on healthcare. There is really no bigger issue that's impacting public retirees. Now, of course, the COLA Commission's underway. We have a number of bills pending before the legislature. There's a lot of things happening that we're trying to improve your overall retirement and specifically your pension. But one of the key issues that is just ongoing day after day that's taking up a lot of our time, our biggest part of our focus, particularly for Nancy McGovern, working directly with our local retirees across the state, is retiree health insurance. And the crisis of affordability that we've been talking about for the better part of the last 3 years. We believe that the only way that we're going to gain control over these issues and protect your benefits is through collaboration. Collaboration with our partners from organized labor, whether it's the PFFM, the various teacher unions, the MassCop, all of the public employee unions across the state. We work together day in and day out to represent the interests of our collective memberships. Now, one of the things that some of you may not realize, depending on where you're retired from, is that we in fact represent all retired Massachusetts public employees. It's not just local retirees, it's not just state retirees, it's not just retired teachers, it's all retired public employees all across the Commonwealth. And all of you are receiving your health care benefits from different sources. So if you're a state retiree, of course, you're getting it from the GIC. But you might also be a local retiree insured through the GIC, or a retired teacher through the GIC. Or you could be a retired teacher or a local municipal retiree receiving your benefits from the city or town that you retired from, or part of a joint purchasing group. And as we described in one of our weekly updates about a month ago, it's very confusing and convoluted, I think, for everybody of the source of your healthcare benefits. And that's where the work that we do day in and day out, whether it's working directly with the GIC and the vendors under the GIC like WellPoint, or at the local level, working with the various cities and towns in the joint purchasing groups and healthcare companies like Blue Cross and Blue Shield. Our relationship with Blue Cross and Blue Shield of Massachusetts goes back many decades, really back to the beginning of our association in 1968. And certainly since the 1970s, we have had a very close working relationship and even a friendship with Blue Cross that in recent years has become even stronger than it ever was before. One of the things we're doing with Blue Cross is that for the third year running, Blue Cross and Blue Shield has hosted a Municipal Health Insurance Summit. It takes place at their offices in Hingham. The summit took place just yesterday on Thursday. Nancy McGovern and I both participated in the summit along with the professional firefighters and AFT Massachusetts, the teacher union, or one of the teacher unions, along with Blue Cross and Blue Shield senior officials. The audience for the summit is the local either public employee committee members, better known as PECs, or insurance advisory committee members from across the state. This is all focused on municipal health insurance. Now, for the PECs, Mass Retirees has the legal authority and responsibility to appoint a local retiree to the PEC. And the responsibility of the PEC in the municipalities that are using this process is to negotiate local health insurance benefits on behalf of local retirees and active employees. So our representative on the PEC works hand in hand with a representative from the firefighters or the teachers or AFSCME and the other local unions at the bargaining table together dealing with local health insurance issues. Now, the other insurance committee that's active across nearly all municipalities is something that's known as an Insurance Advisory Committee, or an IAC. And again, this is where things get a little bit confusing and complicated because we have some communities that are using both an IAC, which is strictly an advisory role, and the retiree representative on the IAC is not appointed by our association. They're appointed by the local government. And many of our IAC retirees are doing a fantastic job, but some of them are the representative of the local government, so the town manager, the mayor, whomever it might be, and that individual is not always keeping the best interest of local retirees at heart. Now, those instances are few and far between, but it does happen. So at the summit, again, third year running, we had nearly 100 retirees and local active employee representatives together at the Blue Cross offices in Hingham for a 2-hour presentation by Blue Cross officials, by mass retirees and the other unions in terms of what we're seeing happening out there. So the affordability crisis, for instance, what is driving the higher and higher costs that we're seeing out there, and what can be done about it, what Blue Cross is specifically doing about it. Nancy McGovern and Mark Thomas from Blue Cross made a very good presentation on Medicare and Medicare eligibility, enrollment, what are the various nuts and bolts of the Medicare plans. And then I participated at the close of the meeting along with for a panel discussion with my colleagues from the unions and Blue Cross and from Gallagher. The healthcare consultant also attended and made a great presentation on the role of consultants at the municipal level. So collectively, we offered a lot of information which is designed to inform and to educate our local retiree and active employee representatives who are representing your interests at the local level. And this is so vitally important because as we're seeing healthcare costs rise, it's happening at the exact same time that we're seeing both the state and municipal budgets constrict. And there's been a lot of reporting on this in the media, whether it's over economic concerns, reductions in federal funding and aid coming into Massachusetts. There's a lot of things right now happening that are causing a lot of concern and a very conservative approach when it comes to budgeting. And unfortunately, just like we saw 15 or so years ago, when municipal budgets and the state budget get tight, it puts a target on all of your healthcare benefits. And we've been down this road before. We're trying to do everything we possibly can to prepare and to prevent your benefits from being attacked and try to find creative solutions together to gain control over these rising costs. Now, as we talked about at the meeting today, unfortunately, we don't see necessarily a reduction in costs, that your monthly premiums are suddenly going to go down. But what we're trying to do is find a way to prevent them from continuing to go up and up and up and up. You cannot afford to continue to pay more, whether it's in monthly premiums or through your out-of-pocket costs. And the worst case scenario would be if we suddenly see a move once again to cost shift onto your backs. So to instead of absorbing these new costs or increased costs through premiums, which the state and local governments are picking up the lion's share of those costs, the easy way out for them would be to suddenly increase your copayments and deductibles or to reduce the quality of your benefits. And that doesn't do any good. It's not addressing the larger overall drivers of higher costs, and it's certainly not helping to keep retirees and active employees healthy. And it's just going to lead to greater costs down the road, and that's not a good situation for anybody. So we're very appreciative of the work that Blue Cross and Blue Shield continues to do in this space. I know Nancy is in daily contact with Blue Cross officials, and the same thing applies at the state level. I think all of you know by now, if you're insured through the GIC, of the very, very close relationship and friendship we have with WellPoint. We've had that relationship for decades, going all the way back to the 1980s when it was the John Hancock plan, and then through the various iterations of Unicare, and today under the leadership of David Morales in WellPoint. So whether you're a GIC enrollee or a local enrollee, we're trying to cover all bases here and work with the folks who are responsible for providing your very, very important healthcare benefits. Now, at the state level, at the exact same time that we're meeting in Hingham with Blue Cross, the Group Insurance Commission held their monthly October meeting here in Boston. And as we anticipated, the GIC yesterday made the announcement of a new plan addressing the issue of GLP-1s for weight loss. And if you've been watching our weekly updates recently or reading the weekly email report that comes out, you know that we have been following this issue very closely. We've detailed the specifics of this, of what the challenge is, and we've also made it very clear in terms of what our concerns are with this overall issue. And this is complicated. These are not easy issues to resolve. And we are very grateful to Matt Vino, the executive director of the GIC, and his team for the approach that they have taken in a very thoughtful, methodical manner to address the issue of cost associated with GLP-1s for weight loss, balancing that with the need for enrollees who have been prescribed these very effective, life-changing medications to continue to allow those individuals to have access to this drug. Now, as we explained in previous reports on this issue, most states across the country do not cover GLP-1s for weight loss for public retirees or public employees. Massachusetts is one of fewer than 20 states that have covered this. Under the Medicare plan, for anyone enrolled in Medicare, whether you are here in Massachusetts or elsewhere, Medicare, by and large, does not cover GLP-1s for weight loss. There are some very limited exceptions to that. And I also need to point out that there's a distinct difference between GLP-1s for weight loss and GLP-1 prescriptions to combat type 2 diabetes. That was the original purpose of GLP-1s. They were found to be not only highly effective of treating type 2 diabetes, but also highly effective of a weight loss medication. And again, these drugs have been life-altering for folks and undoubtedly lead to fewer healthcare costs over the long run once you help people combat obesity. So if you are someone who's prescribed a GLP-1 for type 2 diabetes, this is not in question. Nothing changes for you. But in terms of GLP-1s for weight loss, the new GIC policy and plan changes things a bit. You will still have access to these medications, but you need to enroll in a new plan that was just announced yesterday. The GIC is contracting with a vendor called Vita Health. Vita Health is a California-based company. They focus on weight management and weight loss programs. And the details, we are still trying to iron this out. Again, this was just announced yesterday. We didn't get back to our office until about 3 o'clock yesterday afternoon. So we've been trying to read through all of this material, and I'm actually recording this video for you Thursday evening at about 8:30 at night. I'm still here in the office. So we don't know all of the details well enough to provide that information to you right now. But let me walk you through what we do know. These changes will take effect on January 1st of 2026, so about 2.5 months from now. So it's not going to happen overnight, but these changes are coming. And the GIC will reach out directly to those of you who are currently prescribed a GLP-1. And again, you're not being cut off, that your rug's not being pulled out from under you, and the GIC will reach out in the coming weeks, well before January 1st, explaining the changes, explaining the new program, and most importantly, informing you as to what you need to do to enroll in the Vita Health program to continue to have access to GLP-1s. And the hope here is that by enrolling in this program and becoming actively engaged in the services and the program that Vita Health has to offer, is going to further benefit those of you and those enrollees, and I believe there's about 16,000 current GIC enrollees who have been prescribed a GLP-1 for weight loss. The idea behind this program isn't to take benefits away from you or to make life more difficult. It's to put certain controls into place to make sure that these very effective drugs have the desired effect that they were designed for. And part of that has to be engaging in this type of program, that there's more to this than just simply taking a shot or eventually taking a pill form of a GLP-1, which is in development right now, by the way, and it's rumored to or expected that at least one of the companies that produce these medications will roll out, with FDA approval, of course, a pill form of a GLP-1 perhaps as early as January. And the pricing around that has not been announced, and hopefully that will help reduce these costs and take some of the pressure off. But still, the GIC has made the decision to take this step rather than eliminating coverage, which other plans have done. They're taking the more humane approach to policy making of trying to consider all sides and balance that. Now, of course, the GIC is not going to achieve the kind of cost savings that some may like to achieve through this program. The easiest way for them to save money is just to simply not cover the medication anymore. And again, we give credit to the GIC for not going down that path, like some other states and other plans have done. Now, at the local level, Blue Cross and Blue Shield, Harvard Pilgrim, for two examples, have made the decision that as of January 1st, they are no longer going to cover or provide blanket coverage for GLP-1s as a standard part of their insurance plans. Now, each individual municipality will have the ability to continue to provide coverage for GLP-1s for weight loss through their plans, but it will be individual decisions made by those municipalities. And as the Blue Cross officials shared at yesterday's summit, most of those decisions will be made through the next contract negotiation between the municipality and Blue Cross. And it's going to differ from community to community, but these decisions are going to be made over the course of many months, if not years going forward. I believe a lot of communities will be looking to the GIC to kind of gauge what their experience has been with this new policy involving Vita Health, and there are other vendors out there that provide similar services. The GIC apparently reviewed 4 different companies before deciding that Vita Health was the best approach. So we will be fully analyzing what the GIC unveiled yesterday. We'll be reporting back to you on what we find and also kind of what our view is on this new policy once we have the opportunity to learn more. But we wanted to share with you what we do know at this time. And again, no one is going to lose the benefit that you have now, but there are going to be new requirements in place for those of you who want to continue on a GLP-1 under the GIC plans to continue to have access to this. Now, the underlying theme of both the Healthcare Summit, our day-to-day work, what's happening with the GIC is trying to work together and collaborate to find answers to these very, very complicated issues, very expensive issues, in some cases very controversial in some cases, decisions that are made in terms of your health care. And what's important for us is to have a seat at the table, a voice in this process, to be able to represent our members and make sure that your thoughts, your feelings, your needs are being heard, whether it's at the state or local level across the board. And we're not going to be able to solve these problems tomorrow, but by coming together in a collaborative fashion, all the different stakeholder groups, I'm very confident that we're going to get there. You're going to be better served because of this. Active employees are going to be better served because of this, and Massachusetts will continue to be a shining example of healthcare policy for across the country. But we need to make sure that not only do all of you have access to the best possible healthcare available, but you can also afford to access that healthcare and afford to pay for your share of that healthcare. And that's the difficulty we're facing right now. So stay tuned. We're going to be focusing on these issues going forward. We're also in the coming weeks going to shift back our attention, or at least our weekly reports. Frank Valeri continues to be very engaged on a day-to-day basis with the COLA Commission, where we are anticipating that report coming out and the recommendations coming out of the COLA Commission in December is what the time frame looks like at this time. So as we're learning more and have more to say on that issue and other related issues, we're going to report to you. But for now, hope you're all doing well. We will be back to you again next week with a fresh update. Take care, everybody. Bye-bye.